Good afternoon, everybody. My name is Josh Ratner. I'm the Chief Strategy Officer for Health Alliance of the Hudson Valley. And frankly, we're very excited today to be able to announce some very good news for us and for the entire community. We're hopeful that after today, after expressing what our plan is to move forward, that the community generally understands what Health Alliance's direction will be and what it means to our commitment to deliver quality care to our patients and for the entire community. I want to personally recognize our board. We are represented today by Kevin Ryan, the chair of the Health Alliance board. I'd also like to recognize County Executive Mike Hine. Thank you for attending. We really appreciate it. As well as the Health Alliance Foundation board chair, Glenn Decker. Thank you for joining us today. Copies of the press release for all of you are available. And if you'd like to visit our website, we will also update additional pieces of information periodically to our homepage. With that, I'd like to introduce Dave Scarpino, our Chief Executive Officer. Thank you.
Thank you, Josh. Thank you, everybody, for coming today. I do appreciate it. As Josh said, we'd really like to share some good news with you today and also to give you a little bit of clarity about our vision for the future. Health Alliance has been working with the Department of Health for the last 16 months to seek support for a plan to redesign the delivery of health care in Ulster County. We are pleased to announce a decision by the Department of Health to award Health Alliance a grant in the amount of $6.5 million to advance those plans. Our stated vision 18 months ago was to consolidate operations into a single facility. That was due to declining volumes, and that vision remains intact. However, after evaluating changes in local and national healthcare, the changing landscape, we believe that consolidation will happen after we complete 3 initiatives. Number 1, we need to do more physician alignment. Number 2, we need to work on and introduce to the community population health management. And number 3, we need to affiliate with a larger system. To us, physician alignment means a collaborative effort between us and our primary care physicians and our specialists to redesign the way healthcare is delivered to this community. The hallmarks of it will be increased care coordination and intervention so that we keep people healthy. It's a big departure for us in terms of what delivery means. We treat people when they are sick. Now we are going to intercede and keep them healthy. Number 2, population health management. We are working with larger systems and people who have done population health management for quite a while. And the concept between population health management is really being able to look at analytics. We all have electronic health records. It's taking the information from those electronic health records and being able to treat the sickest among us by knowing what is wrong with them. So if we know someone has a particular disease, whether it's diabetes or hypertension, we can make sure that on a day-to-day basis they get the care that they need, which allows them to stay out of the hospital. And number 3, we need to work with a larger system. We're in an environment where single, small, even hospitals like us will not survive in the future unless we partner with somebody with a little more size. What we're looking there for is planning ability, scale, capital, and access to physician specialists. Our focus will shift toward outcomes, quality care, coordination, all resulting in improved care to the community. What you will see is an increased collaboration between and among healthcare providers as we develop a medical community that will ensure care coordination. At the same time, we will move away from volume-based performance measures and bricks and mortar. That is a fundamental shift for us. In the past, hospitals have always been driven by volume. That's what makes us tick. That's what generates revenue. That's what keeps us going. We've always been in a mode to build more, to build bigger. This is a shift away from those two elements into health delivery, outcomes, improving care, improving health. Very consistent with what Mike Hine is doing with Healthy Ulster. We will continue to improve the patient experience each and every time you touch a member of Health Alliance community. When you walk through the door, you will see, if you haven't already, you will see a better experience. We will be caring for you, but we will be caring about you each and every time. We get to do it 125 times a day through the emergency department. It will be better. This announcement does not signal our arrival at the final destination, but really the beginning of our journey toward changing healthcare delivery in Ulster County. We are very excited about it. This will require a lot of collaborative partners as we move forward. This is a journey. We will need our physicians to work with us. We will need local government to work with us. We will need a partner to work with us. We will need the Department of Health to work with us, payers and employers. This is a collaborative effort. We will be collaborative moving forward. We will be part of the fabric of this community. So thank you for coming. We are excited, and before I take any questions, I would like to give Mike and Shane, if they'd like to say a few words, and thank them for their support.